When our patients find out that they have coronary artery disease or they have blockages in their arteries, as we commonly say during our interviews, and whether or not they find that out in the clinic or whether or not they find that in the hospital when they presented with unstable chest discomfort, what we find is that these patients a lot of times have blockages either from tobacco usage or from elevated cholesterols. And I think at that point in time, a educational process starts. I think that an interventional cardiologist isn't doing their job if they just fix the blockage. I think that's only putting a Band-Aid on the problem. I think here we've made a very conscientious effort of educating our patients in the hospital of not only what caused their blockage, but what they can do in the future to help it from happening again. So one of the differences with the coronary heart and vascular is that we make education just as high as fixing the problem. We make those two go hand in hand. So while the patients in the hospital, they're receiving literature, they're receiving consultations from diabetes, tobacco cessation, and from exercise, so that when they leave the hospital, they're part of a network.
All of my patients that have had heart attacks or stents or significant coronary artery disease, I refer those patients to cardiac rehab after at least their initial event. And within the cardiac rehab, it basically kind of reteaches the patient how to exercise. And there's also a lot of counseling on nutrition and lifestyle changes that are very important as well that goes along with our cardiac rehab program. And even patients that can't or don't participate in our cardiac rehab program, the St. Mary's Wellness Center, in conjunction with our cardiac rehab, offers many classes on controlling diabetes, controlling diet, lifestyle changes, and as well as instruction on exercise. And certainly, we have a wonderful group of nurses in our office that are participate in educating our patients, and certainly at our follow-up visits we always try to take time to educate our patients as well.